Hello, Jake Zimmerman here with Senior Insurance Representatives. In this video, I'm going to dive deep into Part A of Medicare, so stay tuned. Medicare Part A. If you already watched our What is Medicare video, then you probably already know a little bit about Part A. But in this video, I'm going to cover all of the specific details about Part A that you're going to want to know. Medicare Part A is for hospital stays, inpatient hospital care, skilled nursing facilities, and hospice care. Most people don't pay a Part A premium because they paid Medicare taxes while working. Now, you're probably wondering what your cost share is if you don't have a Medicare supplement plan or a Medicare Advantage plan in place yet. The first thing we're going to cover is Part A hospitalization coverage. Here's how it works. If you're admitted to the hospital, you will be responsible for your inpatient admission deductible, which is $1,408. Now remember, this video is being recorded in the year 2020, so if you're watching this in later years, just keep in mind that this number could have increased. Now, if you were admitted more than 60 days, starting on day 61, you will also be responsible for a $352 per day copay. Then, if you were still admitted in the hospital more than 90 days, starting on day 91, you would also be responsible for a $704 lifetime reserve copay per day. And you will only get 60 lifetime reserve days to utilize in your life. Now, if during that hospitalization you were moved to a skilled nursing facility, during the first 20 days, you would actually pay $0. But days 21 through 100, you would be responsible for paying $176 per day during this benefit period. If you were there more than 100 days, then you would be responsible for all costs with no assistance from Medicare. Next is blood coverage. If you needed blood while you were hospitalized, under Part A, you would be responsible for the cost of the first 3 pints of blood that you would need. After the first 3 pints, Medicare pays at 100%. And lastly is hospice care. Original Medicare typically pays for everything associated with hospice care, so you won't have to worry about any out-of-pocket costs in this category. So there you have it. Part A is for room and board in a hospital, inpatient hospital care, skilled nursing facilities, and hospice care. I know it can be scary to think about all of your out-of-pocket costs associated with Part A, but the good news is you can offset your out-of-pocket costs by enrolling in either a Medicare supplement plan or Medicare Advantage plan. The best way to find out more about your options would be to request information on our website or call us directly at 1-800-327-7888. We look forward to hearing from you. Thanks for watching and have a great day.